you explain what happens behind the scenes in the lab?
Typical day starts with shift change. We come in, we find out what the previous shift has done.
I make sure that I check with the previous shift, my teammates, to see if there are any information that they need to relay.
As a generalist, each day when you work, you can work in different departments. No matter the department, we perform some of the same tasks. We do maintenance and quality control on our instruments. Maintenance and quality control ensures that our instruments are operating properly and that we're releasing accurate results.
We may check inventory for reagents and supplies that we need.
And then it would be patient testing, processing specimens.
Those samples can be blood, urine, tissue, swabs.
And they get prioritized whether they're ordered as stat, urgent, timed, or routine.
Sending the results out, calling critical results.
What is the best way to get experience in the healthcare field in high school?
My biggest suggestion is volunteering or looking for junior volunteer opportunities. Taking the classes in high school about healthcare. CNA classes are 6 weeks long, as well as phlebotomy, and you can take those as an older high school student and get jobs in the healthcare field to kind of help you work your way through the system.
I would recommend that you reach out to your local hospital and you ask them if they have or they offer a student internship program.
Contact your local healthcare facility and see if they offer any opportunities where you can come in and shadow a certain department or a certain profession.
What steps did you take to prepare for this career, and what should someone focus on if they are interested in your field? I did 3 years at Appalachian State University, and then I did 1 year at Moses Cone School of Medical Technology. When I graduated, I had a Bachelor of Science degree with a concentration in medical technology.
I started out as a biology degree and then continued on to a 12-month program in clinical lab technology. There are also 2-year associate's degrees that can get you started in the field, and then you can continue your education once you start working.
Community colleges do offer medical laboratory technology programs. Once you successfully complete a program, you have an associate's degree and you're eligible to take the ASCP, or the American Society for Clinical Pathology, their Board of a Certification MLT exam. Once you're an MLT, if you want to pursue a higher education, you can obtain a bachelor's degree through online courses. Once you obtain your Bachelor of Science degree, then you can take and sit for the American Society of Clinical Pathology, their Board of Certification MLS exam. Another pathway that several of my teammates that they have found that works for them is that they have gotten their phlebotomy degree from a local community college. If financially you need to work, you can get your phlebotomy degree and work as a phlebotomist and get that experience in healthcare while you're completing the MLT program. What's something that excites you about coming to work every day? I come to work to serve my community. As an introvert, being an MLS, it fits me better. I don't have as much direct patient contact, but I do make a huge impact in the patient's diagnosis, their treatment, and their care.
There's a lot of teamwork involved in it also, which I enjoy. I love my team. We get along really well. We help each other out. We troubleshoot together. If there is something that I am unsure about that I'm looking at under the microscope, I know that I can always ask somebody to come up behind me and confirm or check to see what they see.
I came into healthcare based on some personal experiences. So I've been a patient and had surgery myself. So I know the importance of what we all do in the background and how it affects your treatment, your diagnosis, and your care plan moving forward.
What are some things people might need to balance or adjust to in these jobs? The biggest thing really working in the lab is going to be prioritization. Be able to jump in when needed for an emergency situations.
From a lab standpoint, there are a lot of regulatory things that we have to make sure we're meeting and qualifying for to make sure we're meeting those standards and putting out the results that we need to do. So it's finding that balance between sending out patient results, but making sure they're accurate.
So as a MLT or an MLS, you can work in different types of laboratories. There are hospital laboratories, there's reference laboratories, pharmaceutical laboratories. Depending on your lab setting, your work hours can vary, but typically labs do run 24 hours a day, 7 days a week. You will work weekday, weekends, holidays. If you're not accustomed to working weekends and holidays, that could be an adjustment for you.
What's a common misconception people have about lab work?
A misconception is that we do on-the-job training or that you can have a science degree and come in and do what we do. A big piece of it is, again, a regulatory aspect, meeting the standards of care, ensuring that the samples and the results that we're sending out are what is expected, because the physicians are going to treat those patients based on the results that we're providing.
Most people think that we only draw blood. While it's true that in smaller lab settings, MLT and MLSs may draw blood, that's not true for larger laboratories.
The misconception can also be that we put a specimen on and it spits out results, and that's that. Our work is done. But it involves you using your knowledge, what you've learned, looking at these results, being able to detect something that is abnormal, and questioning that.
I think a common misconception that people have about lab work is that you do not need a higher education. That is not true. MLTs, or medical laboratory technicians, they have an associate's degree, and MLSs, medical laboratory scientists, they have a Bachelor of Science degree.
What do you find most fascinating about working with medical samples? What I find most fascinating is the smallest drop of blood or urine or body fluid can tell you so much about a patient's condition.
Every sample is a mystery. It's a problem to be solved.
Something as simple as a glucose can lead to a diabetes diagnosis. Something as simple as a biopsy or a white blood cell count can lead to a leukemia or cancer diagnosis.
The way that you can test something and be able to treat somebody and their health condition and diagnose them is amazing to me.
The CDC estimates that 60 to 70% of all decisions regarding a patient diagnosis and treatment rely on lab results. How has working in this position changed the way you think about healthcare? Working in this position has given me a greater appreciation for all healthcare workers.
And they're all 100% important. Every piece of what we do is to care for the patients.
In healthcare, we have a lot of behind-the-scenes heroes. Without them, we could not provide the best possible patient experience.
It definitely gives me a deeper appreciation and understanding of how intricate the healthcare system is. It's a whole network of professions, specialties, departments, and we all come together to diagnose, to treat, and just to give the best care to our community.